Looks like everybody's ready. Everybody ready? Everybody ready? All right, Dr. Jean, take it away.
Good morning. Before we begin, I want to take the opportunity to talk about the logistics for today's press conference. As many of you know, OHA recommends that when indoors with people who are not members of your household, that you should wear a face covering. However, today we are taking off our face coverings when speaking so we can communicate with people who do not speak sign language and depend on seeing a speaker's mouth and lips. The speakers are 9 feet apart. The ASL interpreters are 7 feet from the speakers and 11 feet apart from each other. We also have recently upgraded the air filtration system in the building. Governor Brown.
Thank you, Dr. Jean. Good morning, and thank you all for being here this morning. I'm joined today by Colt Gill, Director of the Department of Education, and Dr. Tom Jean, our Deputy State Epidemiologist at the Oregon Health Authority. Just over 7 months ago, I issued our Stay Home, Save Lives order. Since then, our entire world has fundamentally changed. Over the course of just a few months, life has transformed for Oregonians, for Americans, and for people across the entire globe as we have navigated this once-in-a-lifetime virus. In the spring, I ordered all Oregon schools to close temporarily in an effort to stop the spread of the coronavirus in Oregon. It was a really hard moment in this crisis when we realized that this measure was necessary. From the very first case of COVID-19 in Oregon, I have continued to use science to guide my decision-making. I have enlisted the state's best doctors and public health experts to inform me and my team every single step of the way. My top priority has been and will always be the health and safety of Oregonians. When we temporarily closed Oregon schools, we knew it was going to be an incredible disruption in each student's education. Schools are certainly a centering place for connection, community, and comfort. We knew it would be really hard on teachers who thrive on the energy of their students. We knew it would be really hard on students to be suddenly isolated from friends and teachers and trying to navigate online learning overnight. We knew it would also be very hard on parents. But wow, I think we can all agree this has been much harder than any of us anticipated. What we as a country have learned is that essentially it's impossible to work from home and teach your children a full day's worth of school at the same time. We've learned that this responsibility has disproportionately impacted women, pulling them out of the workforce. For many Oregonians, it can also be a matter of choosing between your child's education, a paycheck, or a career. We've also seen firsthand the challenge of serving low-income and underserved communities, struggling to make comprehensive distance learning work. Barriers to achievement that existed before the pandemic have been laid bare and exacerbated. Not every home in every county has reliable access to the internet or learning devices for all children. And unfortunately, too many students don't have a stable or safe place to call home. You see, our schools do much more than teach and inspire our kids. They make sure that students who are hungry receive warm and nutritious meals. They are a place that cares for students and identifies those who are at risk or in need. And they help provide support for students' mental health and social well-being. Schools are truly the center of it all. The personnel, the teachers, nurses, counselors, librarians, and education support professionals who every day build the personal, individual connections with students that are so critical to their lifelong success. We have all done our best under extremely difficult circumstances. And even under incredible expectations, our students and our teachers have risen to the challenge. Thank you so much to our teachers who are going the extra mile every single day. We knew it was necessary to stay home and save lives. We knew we needed to figure out this virus and how to fight it. And we knew we needed to ensure our hospitals were equipped to handle anything that the pandemic would throw at them. Oregonians made huge sacrifices along the way, and I've been humbled and impressed by all of you. 7 months later, we have learned a lot. And one thing that is abundantly clear, COVID is here to stay. It's here to stay for the foreseeable future. What's also clear is that we must begin prioritizing getting our kids back into the classroom for in-person instruction. Too many of our students haven't seen the middle of a classroom since March. When we get them back in a way that minimizes risk, and we can do this in the greatest extent possible. Doctors tell me that zero risk is not the way forward. It can't be. Coronavirus is here, but we can be thoughtful and we can be smart about minimizing risks so that we can live our lives as safely as possible. A core value of our schools is to place the student and their learning at the center of all decision making. Last summer, Oregon was one of the first states in the country to introduce public health metrics for counties to meet in order to open for in-person instruction. The Department of Education and the Oregon Health Authority committed to review and assess those metrics based on science and data and reevaluate them come mid-October. So here we are today. We have learned more from our doctors and scientists about COVID-19 and how it spreads in our schools. Our updated metrics are based on the latest COVID-19 studies and data, are aligned with CDC recommendations, and bring Oregon in sync with the standards of other states like California. They also help us meet our priority of returning students to in-person instruction. These metrics still place a very high bar for low case counts to open schools, while at the same time providing more flexibility for our younger students. And I'm going to let Director Gill speak to the details. However, I want to be really clear with all of you that we are making adjustments to the metrics based on our best judgment of science. They are not radical shifts. Not every school district across the state will suddenly be able to meet these metrics and reopen today. In fact, the vast majority of our students will not be able to return to class. However, close to 130,000 students will potentially be able to return to in-person instruction with these metrics, and that's a really good thing. For those districts that cannot yet return to in-person instruction, the metrics will serve as a guidepost for where we need to get to so we can return our children to the classroom in a safe manner. I know what you may be thinking. Oregon's cases are rising, just like the rest of the country's are, and frankly, cases around the globe. The second wave that we've all been worried about is here. Today, the Oregon Health Authority will announce another daily record of cases, which will top 600. I will let Dr. Jean tell you more about the latest projections, which show that COVID-19 is spreading faster. This is a time for each of us to take a deep breath and reflect on the steps each of us need to take to keep ourselves safe, our families safe, and our communities safe. The bottom line is that we have to turn the tide and reduce the transmission increases we are seeing in most parts of the state to be able to safely reopen schools for in-person instruction. In order to do that, we are going to be ramping up testing and continuing to focus on contact tracing and supportive isolation. We will be launching another significant public education campaign focused on the main culprit of transmission, informal social gatherings. I will have a few more details coming to you in the upcoming weeks, on our continued efforts to drive down the spread of the disease. As we focus on reopening for in-person instruction, it's also really critical that our schools adhere to the same practices we all use to stay safe from COVID. Due to the lack of any national guidance on school reopenings, every state has created their own framework for getting kids back into the classroom. The Oregon Health Authority and the Department of Education are working together and looking at successful reopenings of schools throughout the world. They created our Ready Schools, Safe Learners framework. Included in it are details for how to minimize risk in our schools. Personal protective equipment will continue to be distributed to educators and school staff, and a supply of masks will be available for all students should they need them. These measures build on the previous 5 million KN95s that we distributed to schools in July. We've also set up a secure, confidential hotline for anyone, teachers, parents, students, to call when they believe that a school is not complying with safety metrics. Complaints can be filed anonymously through Oregon OSHA, and schools out of compliance with health and safety requirements will be subject to corrective enforcement. Before I turn it over to Director Gill, we must stay vigilant in our efforts to continue stopping the spread of COVID as we work towards reopening more schools. I know we are all sick of hearing it, but that means we have to continue with more effort than ever before. The hand washing, the staying home when sick, mask wearing, getting a flu shot, and avoiding gatherings. That last part is really, really critical. We're about to enter my favorite time of the year for the holiday season. It's going to be really difficult to stay smart and avoid those large gatherings with family and close friends. I crave those connections and celebrations so very much. I know we all do. But we have to keep working together to keep the spread of COVID-19 down in our communities. Like I mentioned before, COVID-19 is here. We must retrain ourselves to live in a way that minimizes risk and keeps us all safe. With that, I'm going to turn it over to Director Gill.
Thank you, Governor Brown, and good morning, everyone. Back in mid-August, the Oregon Department of Education and the Oregon Health Authority partnered and released metrics for returning to in-person instruction. Like Governor Brown said, we were one of the first states in the country to do that. School was not in session yet in the United States, and in designing these first set of metrics, we looked to success in other countries. At the time, we also shared that we would review the metrics later in the fall, so that time has come. Today's release is part of that planned review and update. And this is a little bit of what we know now that we didn't have a full grasp on then. Many of our students do far better in in-person instruction, especially our youngest learners that are just beginning to build their basic skills to learn to read. There's more opportunity to build strong relationships with teachers and other adults in the school when the kids are there in person. This impacts learning. We know that for many kids in Oregon, school is the stable source for nutritious breakfasts, lunches, even dinners and weekend meals. Schools provide access to social, emotional, and mental health supports, as well as physical health providers. We know that child abuse reporting from caring adults in our schools is down dramatically. In-person education makes a difference. Our teachers are working hard, but they're not able to connect with kids in the same ways as they do in the classrooms. A key learning from this review is that we can prioritize student and staff health and safety during in-person instruction when community spread is sufficiently reduced and where we rely on and firmly adhere to health and safety protocols and tools that we now have in place here in Oregon. It has been demonstrated in schools in Oregon, across our country, and around the world that when there is strong fidelity to public safety protocols, everyone in the school wearing a face covering, maintaining physical distancing, limiting cohort sizes, cleaning and disinfecting, screening at entry, and frequent washing and sanitizing, that schools are not super spreader sites. In fact, they're good at identifying cases at that screening and getting people to medical support when they need it. The metrics released today are based on current studies and data. They align to the CDC guidelines, and they're in line with other effective standards in other states like California. They help Oregon meet its goal to return to in-person instruction while also prioritizing the health and safety of our students and staff. In developing these, we engaged with many partners, including the Governor's Medical Advisory Panel and the Governor's Healthy Schools Reopening Council. The metrics are effective starting today, and schools will begin reviewing local county data in relation to the metrics next week. The metrics are intentionally a measured and methodical approach to create conditions to return to in-person instruction. Even if every school immediately implemented these metrics on Monday morning, which won't happen, they need time to plan, but even if they did, the majority of Oregon students would still be participating in distance learning. In returning to in-person instruction, Governor Brown, the Department of Education, and the Oregon Health Authority are focused first on ensuring that schools are ready to implement all the public health protocols with fidelity. We cover face coverings, physical distancing, cohorting, screening, cleaning and disinfecting, and a myriad of other safety measures in our guidance. Those can greatly reduce the risk of any transmission at school. Second, we're providing metrics that allow for in-person instruction at reduced levels of risk, but that also set reachable targets for communities to strive for, with a North Star of returning Oregon students to in-person instruction. These metrics are set at a level where Oregon has been in the past, and nearly every county has met in the past. And third, we're making clear how Oregonians in every county across the state can take the steps needed to meet these new metrics and allow our kids to return to in-person instruction. We're asking every Oregonian to prioritize our kids right now and really think about their own behaviors in relation to COVID-19. Let me quickly walk through some of the key changes that you'll see in the metrics. They provide clear guideposts for when in-person instruction is allowable and when it's not, with a North Star of returning Oregon students to physical classrooms. They acknowledge that Oregon's Ready Schools Safe Learners guidance, strong public health protocols in structured settings like schools can greatly reduce the risk of transmission of COVID-19. They provide additional time for schools to prepare to transition between in-person and distance learning. They incrementally increase access to in-person instruction beginning at the elementary level and then moving on through the grade levels. We've switched to a 2-week look back at the metrics data rather than 1 week at a time over the last 3-week period. This is in line with CDC and with the way that many states calculate their data. It removes state test positivity rates in favor of county positivity rates. And finally, it advises the use of an equity decision tool by local schools and districts as they consider a transition in learning models so that they are considering the impacts of all the communities that they serve, as well as the needs for communication and professional learning. Like Governor Brown said, we will be living with COVID-19 for a long time to come. We've learned a lot about how to reduce the risk of transmission, and as a state, we need to recognize the importance of getting our kids back to school. They've been away far too long. These metrics allow for in-person instruction in places of our state where the risk is low, and they provide that pathway for students to their classrooms where communities step up and adhere to public health protocols. We need to remember what students are missing when they're not at school. In-person instruction provides our children and families with more than access to an equitable education. Schools are a center of services to students and families. They offer nutritious meals, access to social, emotional, and mental health supports, as well as physical health services. And for many students, in-person instruction works better. It's all about relationships. Quality learning experiences require deep interpersonal relationships and learning environments where people feel safe, seen, and valued. That's harder to accomplish online. Just last week, I was on a call with students from across Oregon who represent our student tribal leaders. One of the students shared with me that he's a school leader, but he is a struggling high school student. One of the ways that he gets by is by staying after class and asking his teacher for help. What he shared in this meeting was that when a Zoom class ends for everyone. There's no staying behind. The meeting ends, and he has nowhere to turn to for additional assistance. Those are the kinds of students that we need to support in Oregon today. More information about the metrics and Oregon schools can be found on the website at ODE. There's a large banner at the top of that website that says Ready Schools, Safe Learners. Click on that and all the information's there. School safety and other COVID-19 school-related questions can be answered by emailing us at odecovid19@ode.state.or.us. If we follow safety protocols with fidelity, we can fulfill our mission and reduce risk of COVID-19 for our students, our staff, and the families they return to each day. Adherence to the safety protocols is critical. And like the governor said, Oregon OSHA has created a tip line just for this purpose. You can call the tip line at 1-833-604-0884. Oregonians can call that tip line when they believe a school is not in compliance with the safety requirements, and they can file a named or a confidential anonymous complaint with OSHA. It's on all of us to reduce community spread so that we can get our schools to a place where they can return to in-person instruction under these metrics. You can help us prioritize our kids in Oregon by wearing a face covering, by maintaining your distance, by washing your hands frequently, getting a flu shot, and even in the holiday times, avoiding large group gatherings. Thank you. Dr. Jean.
Thank you, Governor Brown and Director Gill. OHA has worked closely with ODE and the Governor's Office since the pandemic started to ensure our plans focus on the shared goal of ensuring the health and well-being of children and school staff. The updates to our school metrics balance two vital priorities. We want to give more students the opportunity to return to in-person instruction when it poses a lower risk to students, staff, and the community. And at the same time, we want to protect students, school staff, and their families from catching COVID-19 and accelerating the spread of the virus in the broader community. While cases are rising in Oregon, and this week we have reported 2 consecutive days of record high daily case counts for the pandemic, including 600 today, along with 2 deaths. We know the virus is not spreading as fast in every community, and that many counties have lower rates of positive COVID-19 tests than the state average. We know some communities can meet these metrics and can reopen schools because they are at lower risk, while other communities still have more work to do to tamp down COVID-19 case rates and community spread. Our modeling shows that COVID-19 is spreading faster. Today's modeling update tells us by mid-November we could see a 70% increase in daily infections statewide unless Oregonians take action to slow the spread and keep transmission rates from increasing. But again, the statewide trends are not reflected in every community. Every Oregonian must take the personal protective actions to flatten the curve of COVID-19. These updated school reopening metrics remain among the most protective in the country, but are now more aligned with the way other states have set their measures. They take into account the measures the CDC has recommended as benchmarks for school reopening, including case rates and test positivity thresholds over 14 days, risk mitigation strategies, and levels of transmission risk across different models of learning. It also draws on our increasing awareness that kids have not been a major driver of outbreaks in Oregon or nationwide. Schools that have maintained safety protocols while providing in-person instruction have not been found to be significant sources of outbreaks or drivers of community spread. We landed on 3 major changes that will better align our metrics with neighboring states and evidence-based practices. First, as Director Gill mentioned, we are removing the statewide 5% threshold for percentage of tests coming back positive. We believe that this simpler approach will better reflect local conditions. With greatly increasing testing availability statewide, we anticipate test positivity to drop, thereby making this metric less meaningful. County test positivity will remain as an important local metric. So this increases local focus. Oregons have many counties that are tied closely to their region or to other states, as much or more so than to the state as a whole. Second, we are changing the review period for examining metrics data to a 2-week period, as Director Gill mentioned, rather than 3 consecutive 1-week periods. This important change will avoid the situations we've seen where a one-time cluster in a smaller county resets the clock for them for an additional 3 weeks. This makes the metrics simpler and easier to understand, and it aligns with CDC, California, and other states. It allows for averaging cases and test positivity results over 14 days to reduce week-to-week variation, which can be an issue, especially in counties with smaller populations. It also allows for week-by-week analysis because the 14-day numbers will still be released weekly. And thirdly, we are expanding from a K through 3 exception to elementary schools up to grade 6 through the general metrics. There are several reasons for expanding K-3 to all elementary age students. At the time of the original metric, limited scientific evidence suggested that children of K-3 ages might be at lower risk for transmitting COVID-19, but newer evidence suggests this may not be the case. However, younger children still appear to have less severe illness than older children and adults. Cohorting of elementary age students is a key strategy for preventing large outbreaks and for allowing contact tracing and quarantine. This means putting students into stable groups. Cohorting is also more manageable with an elementary curriculum. Therefore, in-person instruction for these students carries lower risk than for older students, who have more individualized schedules that involve mixing between cohorts. Finally, remote learning is less effective for younger students who depend on in-person time for effective learning and cognitive and social emotional development. As health officials, we've heard from many families who want to see their students back in school. Just released survey data also tell us that a majority of parents are reporting significant stress in balancing work and supporting their kids in distance learning. This approach gives more schools the chance to reopen based on the conditions in their communities. If COVID-19 is under control, we know we can offer more students in-person instruction at lower risk. If COVID-19 is spreading rapidly and sporadically, these metrics will tell school districts that COVID-19 is spreading too rapidly in the surrounding community and it's too soon to reopen. We believe these metrics represent a cautious approach using a simpler and clearer set of measures that are rooted in the latest scientific evidence. And now I'll turn things over to Governor Brown.
Thank you, Dr. Jean. I think we're ready for questions.
We'll get started with Gary Warner with EO Media. Go ahead, Gary. Gary, are you there? Okay, we'll come back to Gary and start with Lindsay Nadrick with Coin 6. Lindsay, can you hear us?
Hey, yes, can you hear me?
Yes.
Okay, my question, I know kids are really low risk, but in the past we have heard from teachers who worry, they are in high risk categories. They're the ones who could potentially get it and bring it home to somebody else. What do you think the risk is to teachers if more schools reopen?
Director Gill is going to respond, and then maybe Dr. Jean to bat medical science and data.
Thank you. That is a really important question. You know, one of the keys that we know right now is that our students need daily contact with their teachers. When they're in the classroom, teachers are walking by the students frequently at their desks. They're catching miscues. They're catching when students are practicing problems incorrectly, and they're switching that learning. When they are online, a student can be practicing something incorrectly for a long time before that's caught. So the instruction and the academic performance has slowed way down. We know that today we are going to be living with COVID-19 for a long time. We have protocols in place to reduce the risk of spread of COVID-19, especially in a structured setting like a school. We will have limited cohorts, so each educator is working with a limited number of students, not interacting with students from across the school. We have screening at school, so that as students and educators enter the building, they're screening for symptoms, they're screening for previous contacts with people with COVID-19, and they're catching the vast majority of people with COVID-19 at the door. And we also know that this is a time when the world is going back to work, right? So people in the communities across Oregon are going back to work. Our grocery stores are open. Our restaurants are open. Our healthcare facilities and our frontline emergency care workers have been working throughout the pandemic. And many of them also have elevated risk levels. When we do it with the proper protocols in place, we can reduce risk, and we can do our best to keep the safety and health of our students and our staff at the forefront.
We know that there are many staff who are older or who have medical conditions that certainly put them at higher risk of severe outcomes from COVID-19. We also know that these basic preventive measures and the rigorous public health and safety protocols that schools are implementing actually really do work as well. So those are what we have in place to minimize the risk to all people.
Lindsay, our next,
Can I ask a follow-up?
yes, go ahead.
Just given, under these new guidelines, it doesn't really mean, some of the bigger counties like Multnomah County, this doesn't mean they're going to be able to reopen, and we are seeing COVID cases surging. Governor, are you considering more restrictions so Multnomah County and bigger cities can get back to a place where they could meet these metrics to reopen?
So my goal at this point in time is to focus on getting our children back into the classroom for in-person instruction. And that's going to mean all of us, whether we have children or not, doubling down on our efforts to reduce transmission of the virus. And the basic tools that we have are the same things I've been talking about for several weeks now. Obviously, wearing a face covering when you're out in public, watching your physical distance, washing your hands. I would also add it's extremely helpful for those that are able and willing to get the flu shot so we don't have to face the challenges of a twin-demic, both obviously COVID and the flu. And particularly, and this is probably the hardest one for all of us, that we all double down on our efforts to really limit our social circles. And so for me, that means instead of spending Thanksgiving with extended family and friends, we're going to have a very small household Thanksgiving dinner. I love Halloween. I love to dress up. I love to welcome the several hundred kiddos that come to the governor's residence. I love to participate in the parade ahead of time. We're not going to do that. Again, I am doubling down, asking all Oregonians to double down on the incredible sacrifices we have already made to make sure that we are reducing the transmission of the disease in our neighborhoods, in our households, and in our communities. And it's going to take all of us working together. We are truly all in this together, and each one of us can make a difference. So let's get our transmission rates down.
This is Colt. I'd like to add just a little bit to that and note that these metrics, they are reachable. So it was just 2 Mondays ago that the 14-day look back for Multnomah County had them at less than 100 cases per 100,000. That put them in a place where they were eligible, again, just a couple of weeks back, to open to in-person instruction for their elementary schools. And we would want them, of course, to do that in a slow and measured way, bringing in the younger students first and then adding to that. But these are metrics that Multnomah County and other counties around Oregon can reach. They were there just a couple of weeks ago.
Thanks, Lindsay. We'll go next to Wright Gazaway with K2. Go ahead, Wright.
Thank you. Some of the things we've heard today regarding the low risk to students as well as the need to be back in person are not new. My question is, why make these changes when Oregon is seeing a spike in cases, the hospitalizations are up, other states are sending patients here? Can you just address the optics of doing this now when many are concerned about the numbers we're seeing? Maybe each of you can address that.
Thank you, Wright. And that's a really good question and timely. We've obviously been working on these metrics for the last couple of weeks. I've had the opportunity to speak with teachers across the state, with superintendents, with principals, and with students, and with parents about the challenges they are currently facing. What is really, really clear is that in the 7 months that we have been involved in this pandemic and in the couple of months since we released our original school metrics, is that the evidence-based practices and the science and data has advanced, and we're aligning these metrics with the evidence and data that's out there now. Number two, the second thing that's really clear that we didn't know, honestly, at the time, is that with adherence to safety protocol, wearing face coverings, masks, hand washing, physical distancing, what is really clear is that schools are not super spreader events. So that's really important. And then I think, and Director Gill spoke very eloquently to this, the challenge for our students in terms of learning through the internet. I heard during my Healthy Schools Reopening Council meeting from 3 of the students. They talked about the challenge that they and their friends are facing in terms of keeping up with their education, that the social isolation is really, really challenging, and we're seeing the impacts on our kids across the state. So it's all of those pieces and more. Director Gill.
Sure. I can add just a little bit to that. I think it's first important to know that this was part of our planned review. It's what we committed to when we first released our metrics. And as part of that, we are reviewing all the current studies and Oregon's current data. It's also important to know that the metrics that we created are still among the more conservative in the United States. We have states in the United States that don't have metrics. We have states in the United States that require in-person instruction at every school. That's not what Oregon is doing. We're taking a measured approach. We're taking a look at our data, and we're making decisions that bring our students back to a structured environment where we can follow protocols to reduce risk of the transmission of COVID-19. You know, around the world, we're also seeing spikes in other countries. Many of those countries are, again, looking at locking down or closing down sectors of their society, and typically schools are not among those. Schools, again, are these structured environments where students are used to coming in and following a different set of rules than they follow in their own households. In this setting, we can enforce rules that include the face coverings, physical distancing, maintaining small cohorts, and helping to reduce risk of spread of COVID-19. And then I want to be honest here too, this is in the weekly report from OHA. Week after week, we have schools open to in-person instruction in Oregon now. We have about 50,000 students that are attending in-person instruction on a regular basis, and we have had cases in our schools. And we have also had very little transmission in our schools. So our students and staff members are identified early, and because of the protocols in place, we're not seeing transmission. So we think we can do that for more of Oregon students and provide a better service to them.
To add a little perspective to this about our trends, we have of course announced the highest weekly and daily numbers that we've seen to date. I think more than anything, that's a testament to Oregon's success thus far in controlling the pandemic. We remain among the very lowest, the best states in the nation in terms of low case rates to this day. And then the other point I would add is that data shows globally that schools can reopen with minimal risk of spread when community transmission is low. But even in places where community infections are on the rise, outbreaks in schools have been uncommon when sound public health measures are in place to prevent transmission, as we have with our ODE and OHA school guidance.
Thanks, Wright. It sounds like we have Gary. Oh, Gary. Wright, did you have a follow-up?
Yeah, just for Director Gill really quickly. I know a lot of parents are going to be excited about these new guidelines, and I just wondered what a reasonable expectation was for schools to be able to reopen. I would assume it's not, Monday.
No, yeah, thank you for that. The metrics were released, are released today, and they become effective immediately. Monday afternoon will be the first time that schools will get a chance to look at their first 2-week review, the 14-day look back. And then they will begin to have discussions. I'm hopeful those discussions will include community, the staff at the school, and they'll make some decisions to move forward. In the next week or two, we'll begin to see some of our schools open, and others will be sure that they wait for another set of metrics to see that their trend is going in the right direction, that they're not on the climb. The other part that we've advised our schools to do is, again, to use that equity decision tool to make sure that they're thinking about all the communities they serve and the impacts of switching to in-person instruction. There are some challenges to in-person instruction that everybody needs to be aware of. When there is a case that's identified in a school and that person has been in contact with others in their cohort, everyone in that cohort is oftentimes sent home for a 14-day quarantine. That's a real child care challenge that happens, in a moment's notice, and folks need to be ready for that. So some community conversations often need to happen in school communities before they make this decision. I think I'll leave it at that. Thank you.
Thanks, Wright. We're going to go back to Gary Warner. Gary, are you there?
Yes, I am. Thanks for your patience. About a third of the counties in Oregon have had their highest daily totals within the past week. Another third have had them in the past month. Numbers are going up in the state. They're going up nationwide. Why do this now, right before the holidays, when you're going to have a lot of people who are already going to be traveling and getting together regardless of what the recommendations are, and then bring those kids back to school, then have them go away again for Christmas and bring them back to school? This seems like a formula to really expand the pool of possible infection.
Director Gill.
I'll start with this one. So we need to remember too that these metrics are also a state mandate. So they're a protection as well as a model for moving our students to in-person instruction. When county case rates climb, when county case counts climb, when test positivity climbs, our schools will no longer be eligible for meeting this metric. It's one of the reasons we're really counting on Oregonians this holiday season to do everything it takes to reduce spread so we can bring our students back to school. I think a lot of school districts will be also focused on the transition that they make between their quarters or their trimesters or their semesters. That's a good time for them to make that change. They're going to be looking to early 2021 in hopes that these metrics have changed and they can make that transition from comprehensive distance learning, online learning, to being in person with their students once again. And I'm just going to make this plea for all Oregonians to really reconsider their typical holiday plans and those group gatherings, to really think about how they can employ face coverings and physical distancing, getting their flu shot like the governor has said. Those are the things that can get us to a place where schools can open in person. If we're not there in January, then we need to consider other steps in Oregon. That's my belief, to get there. And these metrics will protect our schools from opening when the risk is too high.
You seem to be saying exactly what I was asking, which is why not just wait until January 2nd? Why start this now at a time when there's a lot of movement around, a lot of turbulence in terms of the number of people that you're connecting with?
So a couple of reasons. One is schools need time to plan, right? We need time to even take a day or two away from regular instruction online so that all the school staff can learn about all these safety protocols. For the most part, they've been operating online, and they haven't had to think about face coverings and how you manage physical distancing in a classroom or in a hallway or during a fire drill. So all of those things need to be gone through, and the school staff need some time to do that. Second, this is exactly the time for us to be sharing this with Oregonians, because Oregonians can make choices over the next 2 months to ensure that their counties do meet these metrics when we come back in 2021. I think that if we waited until after and just let everybody continue to live life close to normal when we're in COVID-19 times, that's not using our leadership appropriately. We need to inform Oregonians of the kind of decisions they can make that can improve lives for Oregon's kids.
And Gary, I'll just add, Dr. Jean spoke very eloquently about the sacrifices that Oregonians have made, and as a result, we still have one of the lowest infection rates in the country. And that's because you all made tough choices. You stayed home. You worked from home. You made sure you limited your kids' social circles. You cut down on your informal social gatherings. All of these have really helped keep Oregon's case rates down. But the harsh reality is, I think we're all seeing what's happening not only on the West Coast, but across the entire country, in countries around the world, with substantially increasing rates. I will continue to keep all the tools that are available to me to reduce the transmission of the virus. All of those tools are still on the table. I don't want to use them. I don't want to have to close down restaurants and bars to in-person dining. I don't want to have to close down venues. If Oregonians continue to make the right choices, we won't need to. But it's honestly, it's up to all of us, whether we want to see the transmission of the virus go down or whether we want to see cases go up in Oregon. Dr. Jean, do you want to add anything?
I think those are all great points. Very briefly, I would add that under the new metrics, the great majority of students in Oregon will still be doing remote learning. And it's really an attempt to increase the local focus. So those communities that are successful following physical distancing, face coverings, avoiding gatherings, all these basic measures that we keep saying, they are what will actually make the difference. And those communities that are successful will be the communities where more students will be able to go back to in-person learning.
Thanks, Gary. We have time for just 2 more questions, but just a quick reminder that Director Gill will be available for more questions at 12:15. So we'll go next to Jackson Hogan with the Bend Bulletin. Go ahead, Jackson.
Hi, I was just wondering, this is kind of specific, but when I saw, originally when a school reopens, and if they reopen in the red section, the section where everything has to shut down, even though currently they have in-person, they have until like January 2021 to reopen. And I was wondering why there's such a wide window for that.
Director Gill, why don't you take that one?
Yeah, thank you. That is hopefully some of the kinds of questions that I can also answer at this 12:15 time. It's a little bit in the details. So what's being referred to there is a safe harbor clause in these metrics. As you're transitioning from one set of metrics to another, we didn't want to have an instant change for a school that's currently operating. So we built in a safe harbor. Our metrics have really what we are calling 3 columns. There's a green column that is the time when all students K-12 are allowed to come back to in-person instruction if that's what the local school chooses. There's a yellow column that's on-site and distance learning. That's the column where schools could choose to bring back their elementary students. And then over time, if they can show that they can do that without transmission, could add middle school and high school. Then there's an orange column that's a transition column. This is a time when schools need to look really carefully at the metrics each week and see which way they're trending. They may need to connect with local public health and understand where the outbreaks are in their county. And if they're impacted by those, they may need to move into distance learning sooner. And then there's a red column. Again, these align with CDC. That's a column when we would say that every school in that county needs to move back to distance learning. The safe harbor clause says you're operating this week under current metrics. Next week, we move into these new metrics. If you're currently open and you all of a sudden find yourself in a column like the red column is what's being asked about, then you need to consider moving back into distance learning. We have given a timeline for that between now and January 4th for a school to make that transition. As we have reviewed that data, the only 2 counties right now that are fully in red, where they cannot open any schools, are Malheur and Umatilla County. And so we don't think we have schools that will actually be caught under this circumstance. There are counties close to you that are in the orange and the transition through their test positivity. So Crook County School District is one of those, and they are partnering with the local public health this week to understand what the spread looks like, and they can make that determination under orange on whether they stay open or whether they shift to distance learning.
Thanks, Jackson. We have time for just one more question, so we're going to go to Erin Ross with OPB. Go ahead, Erin.
Hi, thank you. Governor Brown, given the increasing case rates here and across the country, and that the most recent research seems to indicate that these cases are not going anywhere, that trends are going to keep on going up due to external factors that come with wintertime and being indoors more, what do you see these counties that have higher case rates being able to reopen? Right now, Multnomah County is 40% higher than it was before. So with that increasing trend and knowing that nationally scientists think that trend is not going to go away, how will those schools ever reopen?
That's a good question. From my perspective, do I see these counties being able to reduce their virus rates in such a way that we can get our students into in-person instruction in the classroom? The answer is yes. As Director Gill said, several of these counties would have been available for in-person instruction with these metrics if they had been in place a few weeks ago. So do I see an opportunity? Do I see hope? Absolutely. And what continues to give me hope and encouragement is that we've done this. We've done this before. Oregon has continued to remain one of the lowest infection rates of states across the country because Oregonians take care of one another. We're willing to make sacrifices and make changes to our own behavior to protect ourselves, to protect our family members, to protect our neighbors, particularly our vulnerable neighbors, and our community members. So one of the reasons why I think it's important that we unveil these metrics is to give Oregonians hope and encouragement, particularly our school kids. They need to see us doing the right thing. They need to see all Oregonians doing the right thing to bring our transmission rates down.
Thank you.
Thanks, Erin. That's all the time we have for questions today, but again, Director Gill will be available at 12:15 for more questions from reporters.
All right. Thank you. Stay safe out there.